There was one afternoon where we volunteered in India, and we went to an impoverished area by the beach and taught about HIV, AIDS, and basic sanitation. And at the end of the teaching, all the kids just had such a genuine sense of appreciation and just happiness that we were there. And it made me realize that what we were giving them was something that they weren't going to get any other way.
I had a group of backpackers in the mall in Chennai, and something they asked us is what can they do in the city? And something we've realized is that there isn't an avenue to experience some of the most meaningful parts of Chennai culture.
Working with these nonprofits for the last 3 years, we've realized that there's a persistent problem. The problem is that there's a lack of both financial and human resources for nonprofits who are providing vital support to at-risk women and children, orphan children, and minority groups. Without these resources, nonprofits are unable to tackle big social issues in their community, like lack of education.
In Chennai, there are about 6 million tourists a year. About 10% of these fall between the ages of 15 to 24 years old, our target demographic. Travel and tourism account for $118.6 billion a year in India. So what do we know about these travelers? According to surveys, about 50% of them would like to volunteer. But also, only 2% of them actually get the opportunity to volunteer. So there's a large discrepancy between those who want to and those who do.
This is where Meraki International comes in. We provide a solution to bridge the gap between nonprofits and travelers by connecting the two for short and long-term volunteer opportunities. Our solution harnesses the manpower and financial potential of travelers to support nonprofits and enhance the traveler experience.
Here's an example of how a volunteer trip would be run. Travelers would mainly hear about Meraki through our marketing materials at strategically placed hostels and would sign up for a trip at such hostels. On the day of the trip, volunteers would meet at a centralized location where a Meraki guide and bus will greet them. During the ride to the volunteer site, the guide will give some background about the local cultural and social issues and the impact of nonprofits in the area. As an example of a service trip, volunteers would spend the day at an orphanage with children, providing them with English practice and loving human interaction.
Our solution creates 4 primary benefits, including increased resources for nonprofits, increased healthcare services, life skills, and loving human interaction for at-risk women and children, orphan children, and minority groups, promotion of cross-cultural understanding, empathy, and awareness of social issues, and inspiration for travelers to be more involved in service at home and abroad.
The initial $7,500 will go toward our Milestone 1 and our Milestone 2. Milestone 1 is composed of creating our website, creating marketing materials, and paying legal fees. These are our startup costs of $2,000. Milestone 2 is composed of hiring a director, setting up transportation for volunteers, setting up an office space, and running 6 service experiences. These are our initial monthly operating costs of $1,300.
Our total costs are $30,120. We calculated costs using PPP values based off of both the market prices for goods and services in India, as well as costs incurred in the United States. Many of these values came from collaboration with International Alliance for the Prevention of AIDS, another nonprofit currently operating in Chennai. We calculated our annual revenues by multiplying our $15 program donation fee by the volunteer flow we would have per visit. We estimate a volunteer flow of about 20 volunteers per site visit, or 2,040 volunteers annually. These annual projections of costs and revenues are at Milestone 3, meaning that a year from Milestone 3, Meraki will be self-sustainable.
To fuel this operation, the Meraki team consists of a diverse group of leaders. Megan Allen recently graduated with degrees in global health and psychology from ASU. She has vast experience with nonprofits and currently sits on the board of directors for the International Alliance for the Prevention of AIDS and is program director at HEAL International. Chris Workman, a Google employee and master's graduate in biomedical engineering from ASU, has comprehensive experience with technology development and startup ventures. Nick Pfeiffer is an economics major in Barrett at the Honors College. He volunteered in Chennai with a nonprofit last year and has conducted research on economic development, focusing specifically on the financial relationships between consumers and tourists of developed countries and locals of less developed countries. Adlai Stalong is a finance major at ASU. He has been involved with implementing local microfinance initiatives in rural communities in Central America through international NGOs. And I'm Hunter Workman, a biochemistry and global health student in Barrett at ASU. I've worked with nonprofits in Chennai for the past 2 years, and I currently work as a consultant for an international nonprofit. We are committed to the idea that cultural empathy will foster a stronger sense of global community and stewardship. We are seeking your consideration for the Pakis Social Entrepreneurship Challenge, as it will enable nonprofits in Chennai to tackle social issues with a new realm of support and provide travelers with a genuine cultural experience that transcends socioeconomic barriers. Thank you for your time.